Hello everyone, this is Alex. Today we will discuss about some of the probable Q&A for NORCET 2022, ESIC 2022 exams. The subject is Community Health Nursing or a PSM, you can say PSM, Preventive Social Medicine. So near about 20 to 25 questions I will just explain you in detail with examples also. Please try to follow. These are the very important questions for your NORCET. Definitely you will get at least 10 to 15 questions out of this. So these are some of the repeated questions also. So first question is, which measure is used for growth monitoring at Anganwadi center? Which measure is used for growth monitoring at Anganwadi center? So your options are weight for height, mid-upper arm circumference, skin fold thickness, and weight for age. So which measure used for growth monitoring at Anganwadi center? So at the Anganwadi center level, what is the measure? So weight for height, mid-upper arm circumference, skin fold thickness, and weight for age. So what is your answer? Your answer should be weight for age. At the Anganwadi level, you will check the weight for age by using the growth charts. Okay. So weight for height is different. Okay. Usually you will use it to determine the acute malnutrition. You will use this weight for height. Mid-upper arm circumference you will measure by using the Shakir's tape. Okay, Shakir's tape. So and next, skin fold thickness also to measure the obesity or overweight. Okay, so these are the some of the options, and your answer is weight for age is a measure using in the Anganwadi center by using the growth charts. I will show you what are the growth charts and how to calculate. So this is the Shakir tape. Shakir tape is used to measure the mid-upper arm circumference, MUAC, to know the undernutrition. Why you are using means to know the undernutrition. So this is the, and if you see this is a tape, we will tie at the arm. Okay, so this is the upper arm. At the center part you will tie, and you will see measure the mid upper arm circumference means surrounding. Okay, like this. Suppose here 3 divisions, green is there, green and yellow, red. Okay, red for severe acute malnutrition, yellow for moderate acute malnutrition, green no acute malnutrition means normal. Okay, so up to 11.5, so the below 11.5 circumference is there means severe acute malnutrition is there. Suppose if it is a 11.5 to 12.5, yellow color indicating moderate acute malnutrition, and green color means no acute malnutrition. So this is about using of Shakir tape. Okay, so where we will use to tie at the mid upper arm circumference to know the undernutrition status. Okay, and one more option is there, skin fold thickness. So like this we will measure, so to know the overweight or obesity, and this is a growth chart. Okay, growth charts we will use to measure the weight for age. Okay, so that is the option. And next question, full form of DPT. The very straight answer you can give. So your options: dengue, pertussis, tetanus, diphtheria, pneumonia, tetanus, diphtheria, pertussis, tetanus, diphtheria, pertussis, typhoid. So tell me what is your answer? DPT is a vaccine. Okay. So what are the things? Diphtheria, pertussis and tetanus. What is your answer? Diphtheria, pertussis and tetanus. So C is your answer. It's a straight question. And next, what is the dose of iron and folic acid in the Anemia Mukt Bharat scheme? Okay, what is the dose of iron and folic acid IFA in a Anemia Mukt Bharat scheme for mostly for a pregnant woman? Okay, or antenatal mother. So your options like 50 mg and 500 mcg. I mean 50 mg is iron and folic acid. Okay, 60 mg and 500 mcg, 50 mg and 400 mcg, 40 mg and 500 mcg. Okay, so your option for a pregnant woman is ideally suggested by the Ministry of Health and Family Welfare and WHO also. 60 mg and 500 mcg is the correct answer. Okay. So under the Anemia Mukt Bharat scheme, 60 mg and 500 mcg iron folic acid tablets recommended dose. Okay, recommended dose for a pregnant woman. Okay, so what is a Anemia Mukt Bharat scheme? What is Anemia Mukt Bharat scheme means? We will see next. So Anemia Mukt Bharat scheme is newly introduced scheme or a program in India. So it is working on a 6 by 6 by 6 che by che by che. Okay, 6 by 6 by strategy. What is this strategy? It is including 6 beneficiaries, 6 interventions, 6 institutional mechanisms. Okay, approximately 450 million beneficiaries, nearly 50% of country's population will be reached by this Anemia Mukt Bharat scheme. So beneficiary means who are all getting this facility. Like below 5 years of age group and 5 to 10 years of age group children. Okay, and adolescent girls and pregnant mothers, lactating mothers. Okay, like this. So there are different 6 beneficiaries will be there, interventions will be there, institute. That is a big topic to discuss. So under this is a main concept of Anemia Mukt Bharat, working on 6 by 6 by 6 strategy. Okay, so under this thing, how much you will give? So answer we have seen already. So next, which vaccine is not included in Indradhanush program? Mission Indradhanush. It is a Mission Indradhanush. Which vaccine is not included in the Mission Indradhanush program? Means your options are DPT, hepatitis B, meningococcal vaccine, measles. Okay, so these are the options. So under the Mission Indradhanush program, we are giving vaccines to the 7 killer diseases or 7 vaccine preventable diseases mainly. So in this DP, instead of DPT, now we are giving pentavalent. Okay, so it is covering. Okay, when 6 weeks, 10 weeks, 14 weeks we are giving pentavalent. Hepatitis B also we are giving birth dose 6, 10, 14. Meningococcal not there, and measles we are giving at 9 months. Okay, so your option is meningococcal vaccine. So it is meningococcal vaccine is not covered under the Mission Indradhanush program. Okay, so answer is meningococcal vaccine. So this is a universal immunization program schedule after the introduction of the TD vaccine. This is the latest vaccination schedule. Okay, under Mission Indradhanush also we are following the same. So quickly I am giving you a revision. So at birth BCG OPV 0 dose, hepatitis B birth dose, and 6 weeks OPV first, pentavalent first dose, rota vaccine first, and fractional IPV. Okay, injectable polio vaccine first, PCV. IPV and PCV will give it 6 and 14 weeks, and 10 weeks and 14 weeks or 6 weeks same OPV, pentavalent and rota, 3 doses will give. Okay, only 6 and 14 IPV and PCV will be joining. Pneumococcal conjugate, PCV means pneumococcal conjugate vaccine, newly introduced. Okay, 9 months MR. Okay, now measles and rubella. Okay, vitamin A prophylaxis, Japanese encephalitis and PCV booster dose. 16 to 24 months will give DPT first booster dose, OPV booster dose, measles second, okay, and Japanese encephalitis second dose. 5 to 6 years DPT second booster will give, and 10 to 12 years TD, not TT. Okay, instead of TT we are giving TD. Okay, instead of tetanus toxoid we are giving tetanus and diphtheria toxoid. Okay, so and for pregnant women, TD first dose in early pregnancy, after 1 month second dose, and booster within 3 years. Okay, this is about immunization schedule. Okay, next question: which of the following muscles is the site for second dose of DPT? Which of the following muscles is the site for second dose of DPT? Okay, site for DPT simply ventrigluteal, vastus lateralis, deltoid, dorsogluteal. Tell me what is the answer. Type in comment box your answers. Okay, ventrigluteal, vastus lateralis, deltoid and dorsogluteal. So answer is very straightforward. Okay, very simple. So vastus lateralis is your answer. So muscle, usually instead of DPT, I told you in the previous question also we are giving pentavalent, and so we'll give anterolateral muscle, anterolateral thigh, anterolateral thigh region we will give this penta or a DPT vaccine. IM we will give. So anterolateral thigh is nothing but vastus lateralis muscle. Okay, there which muscle will be there? Vastus lateralis muscle will be there. So your answer is vastus lateralis muscle will be there. So deltoid obviously on the shoulder, okay, and gluteal, ventrogluteal or dorsogluteal. Gluteal is a back, buttock region, okay, buttock region. So this is wrong. Dorsogluteal or ventrogluteal is wrong, and deltoid is on hand. This is also wrong. So whereas anterolateral thigh portion, that is vastus lateralis, is your answer. And next, which of the following vaccine is not a freeze sensitive vaccine? Not a freeze sensitive vaccine. Sensitive. Okay, freeze sensitive vaccine kanadi. Okay, so your options are MMR, DPT, hepatitis B, TT. Okay, so which vaccine is not a freeze sensitive? So what is your answer? So here I will write some of the options like freeze sensitive, it means these are sensitive to freeze. Okay, so it should not be freezed. So vaccines, some of the vaccines should not be freezed. So those are DPT, TT, TD and hepatitis B pentavalent. Okay, penta. And heat sensitive vaccines like BCG, measles, or MR you can write, OPV. So these vaccines should be kept in a freezer. Okay, should be freezed. These are sensitive to heat and these are sensitive to freeze. So these can be resistant to heat. So what is your question? Which vaccine is not a freeze sensitive? It means we have to find out the freeze sensitive vaccines. So I told you already, list down DPT is a freeze sensitive, so it means it can be heat resistant, and hepatitis B is a freeze sensitive coming here, and TD also freeze sensitive. Okay, only vaccine remaining is MMR. So MMR is your option. Okay, because it should be kept in a freezer. Okay, so your option is MMR. That's all. And next, what all vaccines are given IM except? Okay, what are the vaccines can give IM? Intramuscular injection दे सकते हैं, कौन सी vaccines and except? So क्या हो सकता है? Hepatitis B, DPT, PCV, MMR. What is your option? What is your answer? So क्या कौन सा वैक्सीन्स IM दे सकते हैं, कौन सा नहीं दे सकते? ओके, सो हेपेटाइटिस बी है, DPT, PCV, MMR. ओके, सो hepatitis B, I told you, IM intramuscular, DPT already we discussed intramuscular, and PCV pneumococcal conjugate also intramuscular. MMR or MR is a subcutaneous, we will give subcutaneous. Okay, at 9 months of age. Okay, so this is your answer, subcutaneous. So these are the intramuscular, that is subcutaneous. So your question is, what are the vaccines given IM except? So this is except. Next question, which of the following test is done to determine whether vaccines are affected by freezing? Okay, what is the test to determine the vaccines are getting freezed or not? Okay, your options are shake test, Montague's test, vaccine while monitor VVM, and orthotoledin test. Okay, so you just focus on elimination. Okay, how to eliminate the options. So you need to find out whether the vaccine is freezed or not. Okay, what is the test? How you will test the vaccine while? Okay, what is your option? First, Montague's is not at all related because it is related to TB. Ortholan test also not at all related, it is related to calcium. Okay, so VVM and shake test, these two related to vaccines. Here shake test is your answer. Okay, shake test is answer. Okay, after diluting, okay, for example, you can write shake DPT. If you take a DPT, if you dilute, okay, if you keep it means normal room temperature or freezing. Okay, if you keep below the freezer, okay, uh, suppose it got frozen. Okay, then what will happen? That efficacy will go. Okay, so how you will check that vaccine while? So by doing the shaking like this. Okay, this is a shaking test, shake test. Okay, not like this. So don't ever shake like this. Okay, so rub the uh, while like this. Okay, and check. This is called shake test. Your answer is shake test. Vaccine while monitor VVM is also very important for examination point of views. Okay, VVM for a heat sensitive or heat resistance test. Okay, to know the heat and expiry thing also. But this is a different. So your answer is shake test to determine the vaccine are affected by freezing or not. Okay, that's all. Next question. A sedentary female worker is pregnant, okay, and attends your OPD for her first antenatal checkup. The calorie requirement during pregnancy is simple. Okay, what is the first antenatal mother calorie requirement in her first trimester? Okay, option plus 250 kilocalories per day, and option B 350 kilocalories per day, option C 450 kilocalories per day, option D 550 kilocalories per day. So tell me what is your answer, please फटाफट type कर दीजिए. Okay, so your option should be between 300 to 3 80 kilocalories per day. So if you get a 300 option also, okay, it is somewhat less, but still okay. And if you get a 380 also, okay, between the any answer also okay. So here your option is 350 plus 350 kilocalories per day for a sedentary. Remember here for a sedentary female, okay, for a sedentary female of a first antenatal checkup. So her dietary requirement, calorie requirement is plus 350 kilocalories per day. So that is your answer. Okay. Next. So severe acute, next question is severe acute malnutrition is defined as mid upper arm circumference as less than MUAC. I already told you in the first question itself, mid upper arm circumference is used to determine, okay, mid upper arm circumference is used to determine the severe acute means acute malnutrition status, okay, acute malnutrition status by using the Shakir tape, Shakir tape, okay. Okay, this is a Shaki tape. So, when we will consider as a severe acute malnutrition. So, I told you red, yellow, green. Three regions are there in this tape. Above 12.5 is considered as a green zone, and between 11.5 to 12.5 is considered as a yellow region, and less than 11.5 is considered as a red. It means severe acute malnutrition. So your answer is A, 11.5 or less than 11.5 is considered as a severe acute malnutrition. By using the Shaki tape, measuring the mid upper arm circumference, you will tell the acute malnutrition. Next question. Emergency contraceptive pills under the National Health Mission contain emergency contraceptive pills, okay, emergency contraceptive pills under the National Health Mission contains how much dose, okay. Option A 0.75 mg levonorgestrel, option B 1.5 mg levonorgestrel, option C 10 mg mifepristone, option D 200 micrograms misoprostol. What is your option? Emergency contraceptive pill, okay, emergency contraceptive pill. Previously, okay, in previous days we used to give 0.75 mg levonorgestrel within 72 hours, within 72 hours, okay, we will give this 0.75 mg levonorgestrel, and after the first dose, after the 24 hours of first dose, we will give one more tablet of 0.75 mg levonorgestrel. But as per the latest guidelines, so this is your answer, 1.5 mg levonorgestrel is the answer. 1.5 mg levonorgestrel we will give, okay. So this will be given by the ASHA worker, by the Government of India scheme. Directly they will give a home delivery also, home delivery, okay. So by the ASHA worker under the government programs, 1.5 mg levonorgestrel tablets will be supplied to the home by the ASHA workers for a emergency contraception. So misoprostol and mifepristone is a not your answer for the emergency contraception, okay. Next question. Antra MPA. Antra MPA is given after every dash months. Antra is a program. Okay. Antra MPA, medroxy MPA stands for medroxy progesterone estate. So it is a injectable contraceptive thing to give a eligible couples or some women, okay, given after every how many months. So your option is 3 months, okay. Injection MPA, Antra MPA injection 150 mg, 150 mg MPA medroxyprogesterone acetate will give every 3 months or every 90 days. Okay, every 90 days we will give one dose. So that is a one of the contraceptive. Okay. Next question. Next question is LARC. What is LARC? Your options are long-active reusable contraceptive, long-acting reversible contraceptive, low-acting reusable contraceptive, low-acting reversible contraceptive. So what is your answer? LARC. Long-acting reversible contraceptive is the answer. Okay, long-acting reversible contraceptive is the answer. Long-acting reversible contraceptives examples like IUDs, okay, or IUCD, like copper T, okay, copper T, intrauterine copper devices, okay, copper T's are a best examples for the long-acting reversible contraceptives. Next question. Which color bag In which color bag placenta is discarded? This is very frequently asked question. Okay, and simple also. So under the biomedical waste management, so you will get lot of questions. Okay, so in which color bag placenta will be discarded? Options are red, yellow, blue, and black. Red, yellow, blue, black. फटाफट आंसर टाइप कीजिए in the comment box. What is your answer? In which color bag placenta is discarded? So your option is direct answer is placenta. Okay, placenta. If you know the biomedical waste management, what is red, what is yellow, or what is blue and what is black. So why we will use all these things? Okay, in red we will discard all the plastic tubes like catheters, syringes, okay, all plastic tubes, syringes, and all plastic items. Okay, so tubes and lines will discard mainly. Okay, main examples, and even gloves, okay, aprons, all those things. And next, yellow, all all infected or soiled linens or items. Okay, will examples like, okay, all human and animal anatomical wastes. Human and animal anatomical waste are body parts. Okay, body parts and blood contained parts also. Okay, so soiled linens or soiled items like gauze pieces, okay, gauze rolls touched with body uh, body, okay, and cotton, gauze pieces, and blood bags. Main, this is also very important. Blood bags are discarded in which container or which color bag? Okay, blood bags are also discarded in the yellow. Okay, because it is contaminated with the body fluid, but that is a blood. Okay, and microbiological wastes also discarded in the yellow bags. Okay, all the uh, human anatomical body parts and fluids contaminated things will discard in the yellow bags. Blue is for glassware, black general waste. Okay, one more is white. You have white. Okay, white is a puncture proof container. Okay, for all sharps like needles, without caps, needles, and like scalpels, okay, etc. Blades, all those things. Sharps, white container for sharps, black for general waste, blue for all glass, broken or unbroken, vials or ampules, all those things will go in the blue. Yellow for all the anatomical and body fluids and contaminated body soiled linens, okay, all these things. Mainly examination point of view, they will ask placenta will be discarded in yellow, blood bank also discarded in yellow, microbiological waste also discarded in the yellow. Red, all type of plastic tubes and lines, pipes, syringes, gloves, all those things. Okay, that's all. And next, which of the following foods contain high dietary fiber? Which of the following foods contain high dietary fiber? Orange, wheat, spinach, and green gram. So, orange, wheat, spinach, green gram. So orange is a fruit, wheat, spinach, green gram. So what is your option? So your option answer is green gram. So green gram is almost containing of 16 grams of high dietary fiber out of all these options. Okay, that is your answer. And next, match the following: Aedes, rat flea, Anopheles, sandfly. So this is related to communicable diseases. Communicable or a transmission epidemiological related topic. Okay, Aedes mosquito, rat flea, Anopheles, sandfly. So your option column B, diseases spread by these agents like malaria, kalajar, dengue, and plague. Okay, so write your answer. So Aedes is obviously, Aedes is a mosquito. It is causing a disease called dengue. Everyone knows in India. Okay, in India, everyone knows dengue is caused by the Aedes anopheles. Okay, Aedes mosquito. Okay, and next, rat flea. Rat flea is cause plague, and anopheles is causing malaria. Sand flea, kala hajar. Okay. So this is a simple thing. You need to remember the causative agents and diseases. Okay, vectors, all those things. If you study, you will get. So your option is Aedes. So A3 and rat flea for B4 and C Anopheles is causing a malaria. Okay, C1 and D2. So your option is A3, B4, C1, D2. So D is your option answer. Okay. Next, components of PQLI include all except. What is PQLI? Components of PQLI. Options are infant mortality rate, literacy rate, life expectancy at age 1 year, life expectancy at birth. What is PQLI? Physical quality of life index. Okay, physical quality of life index. Okay, physical quality of life index is a PQLI, is including all except. What indicator should not be there, what component should not be there or in the PQLI. So in a PQLI you will have a infant mortality rate. PQLI is mainly having a three components. One is infant mortality rate, okay, and second one is literacy rate, and third one is life expectancy yet 1 year. Okay, these are the three components will be there in the PQLI. So life expectancy at birth will be there in the human development index. So not in a PQLI. So your answer is D. So life expectancy at birth will be there in the human development development index. Okay, that is a another index. So in that it will be the PQLI, only you will have IMR, literacy rate, life expectancy at the age 1 year. So this is your answer. Next question. Transmission based precautions are transmission based precautions. So what is transmission based precautions? What are the standard precautions? What are the universal precautions? You should know as a nurse or a doctor. Okay. And what are your options? So your options are airborne, contact, and universal precautions. Option B, airborne, droplet, and standard precautions. Option C, universal precaution, vaccination, prevention of needle stick injury. And option D, droplet, airborne, and contact precautions. Okay, so these are the options. फटाफट आप टाइप कीजिए in the comment box what is your answer. Transmission based precautions. మీ ఆన్సర్ ఏమవుతుందో టైప్ చేయండి. If you guess this question, if you answer this question, definitely you will crack the exam. Transmission based precautions. So mainly universal precautions and standard precautions, okay, will be there. Okay, so in the standard precautions are transmission and transmission based precautions. So in the transmission based precautions, mainly how the disease will be transmit. Okay, so to prevent that we have to focus on three things. What is that? Okay, what is that? Contact, droplet, second one is droplet, third one is airborne. Okay, so how? So transmission mainly depends on three things. What is contact, droplet, and airborne? So your option is this one, droplet, airborne, and contact precautions are called as a transmission based precautions. Okay, remaining are different. And next, SSPE is the complication of which of the following disease? What is SSPE? SSPE is a complication of which of the following disease? Okay, your options are EBV, Ebola virus, or measles, varicella, and mumps. What is the SSPE? Subacute sclerosis and encephalitis. Subacute, acute, sclerotizing, panencephalitis. So this is a rare condition. Usually we will see in the complication of the disease measles. Your answer is measles. Okay, in a measles disease, so in a due to the measles disease, a complication may occurs in a humans rarely. That is called SSPE, subacute sclerotizing panencephalitis. Okay, that is the option. And next, which of the following is not a viral disease? Which of the following is not a viral disease? Okay, options are scrub typhus, Japanese encephalitis, dengue fever, Ebola disease. Okay, which of the following is not a viral disease? Please answer this question first. So see, dengue is a viral disease, Ebola is viral disease, Japanese encephalitis is also same thing. Okay, your option is scrub typhus. This is a something different, rickettsial disease. So scrub typhus is not a viral disease. And next, weight of a newborn baby will quadruplet. Very, very important. Weight of a newborn baby will be quadruplet. Options are 6 months, B 1 year, C 2 years, D 3 years. Write your answer in the comment box. Okay, weight of a newborn baby will quadruplate. Okay, so weight of a baby will be quadruplate is very important question. Your baby's weight will be doubled by the 6 months, triple by the 1 year, and quadruple by 2 years. So answer is 2 years. Okay, and next, recommended time period for hand hygiene or a hand rub. Okay, options are 20 to 30 seconds, 40 to 60 seconds, 1 to 2 minutes, at least 2 minutes and more. Very easy. Okay, write your answer in the comment box. Okay, recommended time period for the hand hygiene. Okay, answer is 20 to 30 seconds for hand hygiene or hand rub, 20 to 30 seconds, 40 to 60 seconds for hand washing. So 20 to 30 seconds is answer. Which of the following best described COVID-19? Which of the following best described COVID-19? Options are pandemic, endemic, epidemic, and sporadic. You can write this answer also. Write your answer in the comment box first. This is very common now. Okay, not common now. We are spending with this. Okay, we are living in the pandemic. Okay, COVID-19 is a pandemic. Okay, so what is a pandemic? What is endemic? What is epidemic? What is sporadic? Means pandemic means at a time more than in a so entire world if it is spreading at a time. Okay, so sudden outburst in a more than 2 geographical areas. Okay, so that is a pandemic. Endemic means so disease it is present in the throughout the year in a particular constantly in a particular area. Okay, limited to that area, so that is endemic area, endemic disease. Epidemic is a sudden outburst of disease in some regions. Okay, okay, so that is epidemic. Sporadic is a different. So these are the options, and your answer is pandemic. And next, Covishield vaccine is contraindicated in. Covishield vaccine is contraindicated. Options are previously allergy to first dose of Covishield, history of carcinoma, history of pollen allergy, history of radiation therapy. Okay, so eliminate. History of carcinoma is not a contraindicated. History of pollen allergy also not a contraindicated. History of radiation therapy also not contraindicated. Previously allergy of first dose of Covishield. Once if you have a history of if you have a allergy to the Covishield first dose, definitely you should not go for the not second dose. Okay, so are any hemolytic diseases are like that, some of the contraindications are there. So in that situation we should not give the Covishield. So your answer is A. And next question, India's first indigenous COVID vaccine is relate. I am asking all COVID related questions. These are the current trends. Okay, so India's first indigenous COVID vaccine. Options: Covaxin, Covishield, Moderna, and Sputnik. Covaxin, Covishield, Moderna, and Sputnik. India's first indigenous vaccine. Write your answer in the comment box. Type your option first. So Covaxin is your answer. Okay, so which is developed by the Bharat Biotech. Okay, so it is a first indigenous COVID vaccine. Okay, next, India started COVID-19 vaccination with Covaxin on date 16th Jan 2021, 10th Jan 2021, 16th March 2021, and 18th May 2021. When the COVID vaccination started initially Tell me the date. Type fast. So 16th Jan 2021. 16th Jan 2021. You need to remember this thing. 16th Jan 2021. So first COVID-19 vaccine started started in India. Okay. Next, India crossed 100 crore vaccination, 100 crore COVID vaccination on. Okay. When India crossed 100 crore COVID vaccination on 19th October 2021, B 20th October 2021, 21st October 2021, 22nd October 2021. So continue dates in the October 2021 only. So you will get definitely confused. So what is the correct answer? So on the option B is correct. And 20th October 2021 is the answer. But most of the newspapers or in the TVs, it is published in the 21st October. But by the WHO tweet, okay, it is given. So WHO tweeted on 20th October 2021 night 9:30 p.m. So officially or technically the answer is 20th October 2021. So next question. Which of the following disinfectants is used for cleaning in COVID isolation units? So this is also very widely using nowadays for spraying for disinfectants in the all the COVID areas. Options are sodium hypochlorite, formaldehyde, glutaraldehyde, formalin. So please type your answer fast in the comment box. What is the disinfectant solution to clean the COVID isolation units? Sodium hypochlorite, formaldehyde, glutaraldehyde and formalin. So your option is sodium hypochlorite. 1% sodium hypochlorite is using or spraying to disinfect the COVID isolation units. Okay, that's all for today. If you like my content, please like, share and subscribe. If you have any doubts, please write in the comment section. Okay, and if you have any corrections also, please write in the comment section also. Okay, thank you so much. That's all for today. We'll meet another day with another